You evaluate a 2-day-old infant. The infant weighs 5 pounds, is irritable, has a stuffy nose, has been having diarrhea, and isn't eating well. Also, the infant has coarse tremors all over the body. The pregnancy was significant for oligohydramnios, maternal diabetes and maternal lupus, and maternal hypertension. The mother isn't in a position to be giving much of a history. However, her friend who's with her says that the mother has been using multiple drugs over the course of her pregnancy. Currently, she's taking phenytoin, and at some point during the pregnancy, she was taking an antibiotic, an unknown antibiotic. What is the definition of oligohydramnios? Less than 5 centimeters on the amniotic fluid index, or any single pocket less than 2 centimeters. What percentage of pregnancies see oligohydramnios? About 4% of pregnancies. What are some complications of this? Deformities like club feet, facial deformities, and pulmonary hypoplasia. What are causes of oligohydramnios? Premature rupture of membranes, urinary tract abnormalities, so the fluid comes from the urinary tract, and so if there is a blockage, it won't get there. Placental insufficiency, twin-twin transfusion syndrome, so 2 twins and one of the twins is taking more of the blood flow, or certain medications that the mother might be taking. These include ACE inhibitors, NSAIDs, and trastuzumab. What is trastuzumab used for? HER2 positive breast cancers. What's the definition of polyhydramnios? Greater than 24 centimeters in the amniotic fluid index. What is the fetus at increased risk for with polyhydramnios? Abnormal fetal positioning, placental abruption, and premature rupture of the membranes. What are the most common causes of polyhydramnios? Gastrointestinal anomalies, fetal hydrops, and maternal diabetes. So gastrointestinal anomalies can include anatresia, so the infant is unable to gulp down and process the amniotic fluid, and so it just stays in the amniotic space instead of being moved or being drunk by the fetus. What are likely complications to the maternal diabetes that the mother had? So maternal diabetes can lead to caudal regression syndrome and macrosomia, which causes increased risk during birth for birth injury. What is caudal regression syndrome? Abnormalities in the lower spine in a fetus. What is the glucose level of an infant born to a mother with maternal diabetes like? Hypoglycemic. The infant is used to greater levels of glucose in the blood, and so when those are removed, when the infant is separated from the mother, there's hypoglycemia. What ion levels are low in infants born to mothers with maternal diabetes? Calcium and magnesium. What are lung abnormalities seen in infants born to mothers with maternal diabetes? Surfactant deficiency, perinatal asphyxia, and respiratory distress syndrome. What will the blood count of an infant like this likely show? Polycythemia, leading to hyperbilirubinemia and hyperviscosity. So, increased growth in these infants due to increased levels of insulin leads to low oxygen levels. The infant responds with polycythemia, more blood cells. The mother had maternal lupus. What are some likely problems that a fetus could experience with this? The fetus can have neonatal lupus syndrome, which includes a rash, fever, a low blood count, a heart block, and a heart arrhythmia. You can also have a higher incidence of first trimester miscarriage. What is maternal hypertension associated with? Babies that are small for their gestational age. With the baby's symptoms of a stuffy nose, diarrhea, difficulty eating, and also tremors, what is the likely drug of abuse that predominated with this mother? Neonatal opiate withdrawal syndrome is what this describes, and so she likely used opiates or heroin. The baby is likely going through opiate or heroin withdrawal. What is the effect of tobacco on infants? So tobacco use in pregnancy is associated with preterm delivery and placental abnormalities. What is the effect of cocaine or amphetamine use during pregnancy on a fetus? The risk of miscarriage is increased, and there's possible ischemic consequences, so infarctions in the fetus. Also, ileal atresia and cutis aplasia, where large portions of the skin don't develop, are possible. What is the most common teratogen? Alcohol. What are the causes of alcohol use in a pregnant mother on the fetus? Neurocognitive impairment and fetal alcohol syndrome. This results in a smooth philtrum, short palpebral fissures, a thin upper lip, and growth restriction, as well as microcephaly, so a small head. This mother takes phenytoin. What is this associated with? Intrauterine growth restriction, nail hypoplasia, finger hyperplasia, and dysmorphic facies, so facial abnormalities, as well as cognitive delay. This mother was also taking an unknown antibiotic. What type of antibiotic could cause tooth discoloration and inhibit bone formation? Tetracycline antibiotics.